the public health, the health system, the healthcare delivery system, which is provided in India, how it is functioning. That is what we are going to learn about today. Okay, so this is the index overview what we are going to learn today. Let's start with the terminologies first. So these terminologies are very important. Like, you may be asked what's the difference between healthcare and medical care. Okay, so if we say healthcare, it includes all the factors, like the factors of food, housing, sanitation, environment, all will be included in the healthcare. Okay, and in case of medical care, it will be only the personal service which is provided directly by the physician. So when we go to the OPD, like in the tertiary sector, then they come with the chief complaint, and the doctor will be prescribing according to the chief complaint the treatment which is required. That will be the medical care. But if we consider the other factors like food, housing, sanitation, environment, which is affecting the health, which is leading to that particular chief complaint, then we call it health care. So we need to know this difference. Next is comprehensive health care. This is also very important. So if you are asked to define what is comprehensive health care, then you cannot miss out these words like preventive, promotive, curative health services from womb to tomb. For every individual residing in a defined geographic area, we call it comprehensive health services. So it will be focusing upon the prevention, promotion, curative health services, starting from the once a life is going to be formed till the death. That is what is meant by comprehensive health care. So very commonly asked in the Viva also, like comprehensive health care. So when we go for the theory Viva, most commonly asked is define health, definition of health, define epidemiology, define comprehensive health care. These are very commonly asked, so each and every one of you need to know it. Okay, very simple till now. Next, the most important definition, another definition, that is the second bullet, main bullet, that is primary health care. This is also very important. So every one of us needs to know the definition, how to define it. So primary health care, it is defined as essential health care made universally accessible to individuals and acceptable to them, and at the cost the community and the country can afford. So everyone, please by heart this definition. You may be asked long question also, define primary health care, essentials, these elements of primary health care, principles of primary health care. This can be a long question, okay? So we need to know this definition, that is essential health care made universally accessible to individual and acceptable to them, and at the cost the community and the country can afford. So this is the definition. Next, the elements of primary health care. So there are 8 elements. This is the mnemonic. Mnemonic itself is the elements. So E will stand for education. L, instead of L, here we are going to remember as immunization. Again, another E will be standing for endemic. Then M will be standing for maternal and child health. Okay. Then another E will be the essential drugs. N will be the nutrition, T will be the treatment of the common diseases and injuries, and S will be the sanitation. This is how we will remember in the mnemonic form elements of primary health care. So which education? Education concerning the prevailing health problem and the methods of prevention and controlling them. So if there, for example, in the community, if the people are aware, if the community are aware, like what are the basic signs and symptoms for diarrhea, dehydration, because of diarrhea, then if they are being provided the education, like if such and such symptoms developed, what are the basic measures which they have to take up, the home remedies which they can take up before coming to the healthcare centers. Such kind of education should be given to the community. This is one element. Okay. Next, second element, promotion of food supply and proper nutrition. Food supply and proper nutrition, which is provided by various schemes and programs at various age group level, we already know. Then third is adequate supply of water and basic sanitation. Fourth is maternal and child health, including family planning. Immunization against major infectious diseases. Okay, we know it in the immunization schedule. Then prevention and control of locally endemic diseases. So based upon the different geographic area, there will be certain diseases which are common in that particular area. So how to prevent it, how to control it, these things should be given, such kind of education should be given to the community. So if that particular geographic area is prone to malaria, then the use of mosquito nets, how to use the chemicals, okay, how the personal protection, all these things should be given, the education should be given to the community. Then next is appropriate treatment of common diseases and injuries. Then next is provision of essential drugs. So these are the 8 elements of primary health care. So we already defined previously that primary health care is the essential health care made universally accessible to the individuals. Everyone should be accessible to it. They should be acceptable. It should be acceptable to them, and at the cost the community and the country can afford. So it should be at the cost, the cheapest cost, where the community and the country can afford. So if you are asked these 8 elements, if you are asked to give an example of each of the point, then you should be able to give the example based upon this definition, that is accessible to the individual, acceptable to them also, and the cost should be affordable. So like education, like how I already told, like regarding the dehydration education, like simple ORS or home-based liquids, fluids which can be given to them, which are the fluids which will be avoided during the diarrhea. Those kind of education you can give as an example. Then promotion of food supply and proper nutrition, that we can give an example, like if it is in the infant, based upon the IM and CI, what are the nutrients which should be included in the food of the infant, okay, carbohydrate, protein, fat, and which are the food which are rich in carbohydrate, protein, fat. This can be given as an example for the number 2 element. Then adequate supply of water and basic sanitation. Okay, so let's start from the 4th element. The 4th element, maternal and child health, including family planning. So we have learned from the family planning classes what are the methods, the terminal and the terminal methods, then the spacing methods, and those services which are acceptable to the individuals. Okay, so this kind of method, what are the methods? There are various methods. So which are the methods acceptable to them, that should be provided. Okay, then this one, immunization against major infectious, no need to explain, we already know, NIS. Then prevention and control of locally endemic diseases, that we already gave the example of malaria. Then appropriate treatment of common diseases and injuries. Common diseases and injuries will include this ARI, diarrhea, same thing again, repeated, which are very common in the under 5 children. Then provision of essential drugs also same thing, like which includes the treatment for the diarrhea, ARI, then all those paracetamol and all those things will be included under the essential drugs. So these are the elements of primary health care. You have to, you can remember through the mnemonics, and you can give an example one each. If you are asked in the exam what to define primary health care, then the elements of primary health care. Next, coming to the principles of primary health care. So principles, there are 4 principles. So sometimes we get confused when we are asked what are the elements of primary health care, what are the principles of primary health care. Please do not make the mistake. Elements we can remember from the mnemonic of elements itself, and regarding principle, there are only 4 principles, which include equitable distribution, community participation, intersectoral coordination, appropriate technology. Okay, so here also we need to know the basic idea and give one example each, then you can write your own in the exam. So by equitable distribution, we mean that based upon the need, the services should be made available, okay, based upon the need. So there is a difference between equal and equity, okay. Equal means 50-50, okay, but equity means according to the need. Like if there are two villages, village A and village B, then you are going to provide some family planning methods which you are going to provide to the village A and village B. So if the number of the target couple in the village A and village B are and you have 100 of these family planning methods, then when you distribute this in these two villages, you have to distribute according to the equity, according to the need. Okay? So by according to the need, we mean that if how many target, we need to first know how many target couples are there in village A, then how many target couples are there in village B. So if there are more target couples in village A, then you will provide more. If there are 100, then you are going to provide 70 to the village A and 30 to the village B, like that. That is known as the equitable distribution. That is based upon the need. And if it is equally, then irrespective of the number of the target couple which is available in the two villages, you will be providing directly 50-50 to each of the villages. Okay, so that is the difference. So when we are asked equitable distribution of the primary health care, meaning that in India, we know that the population of India, majority are residing in the rural area. Okay, it is divided into rural and urban. So I hope you all know the criteria for division of an area, which is whether this area is belonging to the urban or rural, that you need to know. And another thing is, you have to know that 70% of Indian population is residing in the rural area, and the remaining 30% is an approximate value. Okay, so remaining 30% will be in the urban area. So if it is about the healthcare delivery system, the facilities which you are going to provide, then by equitable distribution, we have to make sure that majority of the health facilities are available to the rural area, right? Because 70% of the population are residing in that area. That is known as the equitable distribution. But what is happening in the current scenario? We have many of the private hospitals and many of the health facilities mainly in the urban, metropolitan cities, mainly in the center. Okay, so this is not an equitable distribution. So if, according to the principles of the primary health care, there should be an equitable distribution, that is according to the need. First point. Second point, community participation. So when we talk about community participation, it is not only the health care workers who are going to provide the services, that principle, elements which is included in the primary health care, that is not provided only by the healthcare workers, but the participation by the community is of major importance. Like ASHA is an example. Okay, then next is, and the village volunteers. There might be volunteers which are coming up, like in the this COVID pandemic scenario. Also, we can see that in the village areas, there are community, the volunteers are coming out and they are helping in the distribution of the food or taking care in the quarantine center and all. This is one example of the community participation. Not only the healthcare workers, but the volunteers from the community are also coming up, right? Then the third principle, intersectoral coordination. Intersectoral coordination, meaning that not only the health sector, but the other sectors also need to be coordinated. So you may be asked to give an example. So you can give many examples like agricultural sector, then PHED sector, okay? Then all this will be included, like agricultural sector because they will be providing the nutrition. Then PHED because they will be providing the water. So sanitation was one of the elements, okay? Food supply and water sanitation was one of the elements, so that is another sector. And those things can be given as an example of the third principle. The fourth principle includes appropriate technology. So in appropriate technology, it means that we may be having many highly equipped instruments may be available, but the thing is that if the individuals or if the country is not able to afford it, then it is of no use. Okay, so what we need is what the country and the what the country or the what the community or the country can afford. That was the definition, the ending of the definition, right? So, but that particular technology should be scientifically based. Okay, it should be cheap and it should be scientifically based. For example, ORS. ORS is very simple. It doesn't take. It is very cheap. It doesn't take much. It doesn't consume much of the money resource for preparing producing it, and also preparation at home level is also very easy. So this is one of the example of appropriate technology. Okay, ORS is one of the example. So when you are asked an exam, please give an example of each of these, and you have to know the meaning. That's all. So if you are, you can be asked the definition, principles, and the elements. Okay. Now let's come to the healthcare delivery model. This is the model of India. So we have here in the column, we have input, then the healthcare services. What are the services to be given to the people? Healthcare system, through what system these services will be provided, and the outputs. Output means the result, the changes in the health status. So in the input, we have the health status or the health problem. Okay, whatever problem we are having, communicable, non-communicable, whatever, that will be included in the input. Next is resources. So in the resources, we have to know 4 M's. Okay, man, money, okay, then material, then minute. Okay, man will be the manpower. Okay, money, we need money also. Then material, that definitely we need the materials. Then minute means the time. Okay, we need time. So these are the resources. So if you are asked about what are the resources in the healthcare delivery system, you have to tell about these 4 M's for easy remembrance. Now the healthcare services. What are the services to be provided through this input? Will be in the form of curative, preventive, promotive. Okay. Next is healthcare system. It can be provided through the public, through the private, voluntary services, indigenous form of system. So these are the 4 healthcare systems which are available in India. Public will be through the government, private will be the private, then voluntary will be like the NGOs, then indigenous, we know AYUSH. Okay, these are the system which is being providing the healthcare services, the curative, preventive, promotive services which will be provided. And we'll see the changes. That will be the output. So this is the healthcare providers in India, that is under the state government, under the central government, and the non-government. So the providers can be divided as state level, central, and the non-government. Under the state government, we have the public health department, medical education department, municipal administration, non-allopathic system. Okay, these are under the state government. Okay, then under the central government, we have Ministry of Health and Family Welfare, Ministry of AYUSH, and other ministries are included, like other ministries like railways, labor, mines, shipping, steel, etc. These are also included. Then next is the non-government, that is private hospitals, private practitioners, NGOs. These are the non-government. Okay, these are according to the level. Next, coming to the public healthcare delivery system. So we can divide this public healthcare delivery system into national level, state level. Okay. So first, coming to the national level, under the Ministry of Health and Family Welfare, we have this DGHS, Central Health Services. Okay, these things will be there included. Then under the state the Department of Health and Family Welfare, we will have the head, secretariat, state directorate. This will be there. Then at the district level, middle level management link, overall control responsibilities will be of that particular district will be taken up at the district level. Not of much important, but this one is very important. Public health care, we can divide according to the area, that is, as I told already, urban area, rural area. Okay, so what we know is that this rural area, 3-tier system, okay, PHC, this primary, secondary, and tertiary level, which we already know. Subcenter and PHC will be in the primary, like that, we already knew. from before. So that one is the three-tier system which is being practiced in the rural area. And please do not forget that for the urban area also there is healthcare delivery system. Okay, so we will come to this urban area later. Let's come to this rural area first. This rural area, we have the best at the grassroots level. The first center which comes in contact with the community is this sub-center. Like this, this is the most peripheral contact between the primary health care system and the community. Okay, and in the sub-center there will be one healthcare worker and ANM. Okay, so ANM is the head. No doctors are there in the sub-center. Very commonly asked in the exam, and most common mistake we make. Okay, in sub-center, no doctor, only ANM. ANM is the head. Population covered in the population covered is 5,000, and in the hilly difficult terrain area it will be 3,000. Please, every one of you need to know the population which is covered by each of the centers, okay, and who are present in each of the center we need to know. So in the primary health care, the next level, that is, it has got, this is the area, this is the center from where the medical officer or the doctor is posted. So if you are asked which is the first level where the community comes in contact with the doctor, it will be PHC, okay, because the doctors are being posted in the PHC. Okay, most periphery part. And if you are asked which is the facility where the community comes in contact with the facility, the healthcare facility, then it will be sub-center. Okay, so please do not forget this point, that some sub-center it is run by the ANM and the healthcare worker, and in case of PHC there will be doctor present there, and the paramedical staffs will be there. And the population covered by one PHC is 30,000 population, and in difficult hilly and difficult terrain area it will be 20,000 population. So under one PHC, how many sub-centers might be there? Around 6 sub-centers might be there. Okay, because 30,000, no? 30,000. So if we divide it, then we can cover around 6, right? That is why. Okay, the next is Community Health Center. Community Health Center, we have this Community Health Center, which is also known as the first referral unit. We will come to that first referral unit. And under Community Health Center, the population covered is 80,000 to 1.2 lakhs. One Community Health Center will cover this population, meaning that under one CHC, there can be 4 PHCs. Okay, and the specialized services. Okay, specialized services will be available in the Community Health Center. Okay, only that is the difference. So every one of us, we need to know. And another thing very important, based upon our Meghalaya, we have to know, like for Nigrims, when you become an intern, where you will be posted will be the Community Health Center. Okay, Bharimbong. So Bharimbong, this Community Health Center will be there. And under this Community Health Center, since it is a hilly region, we have 3 sub-centers. Okay, we have 3 sub-centers under the Bharimbong CHC. Okay, so you have to know this also, because you can be it can be asked in the Viva in order to know regarding your own college also. Sometimes it is asked. But this is just the health statistics. Okay, so let's come to IPHS public health standards regarding the sub-center. So according to the IPHS, a sub-center, what are the services and what are the facilities should be available at a sub-center according to IPHS. That is what we are going to see now. So sub-center can be divided into 2 types, type A and type B. So the main thing is that in type B, delivery can be conducted, okay? And in type A, usually no or occasional delivery. That is the basic difference between the type A and type B sub-center. Your Viva question may be like, Like, which is the first healthcare delivery system which comes in contact with the community? Then your answer will be subcenter. Then next, they can ask you what is the population covered by a subcenter. Then you have to answer that again. Then what are the types of subcenter? You know, type A, type B. What is the difference between type A and type B? Then you have to know that the deliveries are conducted in the type B, no or occasional delivery. So these things you have to know it. Okay. Next. Okay, these are the services which are provided under the subcenter. That should be provided according to the IPHS standard. Okay, services to be provided. Then physical, then monitoring, then manpower, quality assurance, maintaining the record of the particular subcenter. Okay, these are the services like maternal child health services. Okay. Safe abortion, family planning, contraception. For example, puberty insertion, that should be available at the subcenter. A&M can do it. Okay, and then like providing the other barrier contraceptive methods to be made available, emergency contraceptive methods. Okay, curative services, basic curative services that should be made available. Then adolescent health care, then school health services, water and sanitation, outreach services. By outreach services, we mean the village health day, okay? That's all nutrition day, village health and nutrition day. Usually once a week, this from the subcenter, people, the A&M accompanied by the ASHA and sometimes the medical officer who is posted in the PHC where that particular subcenter is covered, can also accompany, and they will go to a particular area like the club or like in a community hall or of the particular village, and they will provide services out there. Okay, like that services and health talks can be given there also. So those kind of outreach services, village health and nutrition day. So outreach services should be matched. These are the services which is to be provided by the subcenter. The National Health Program, all the programs will be included. IDSP, we already know. We already had a class of IDSP also. So what form will be available at the subcenter? Which form? There are three types of form. Any idea? Form S. So please read up IDSP. Form S will be available at the subcenter. Medicinal herbs. Plantation will also be there. Vital events. Vital events means the morbidity, mortality of the particular diseases. Then regarding all those record maintenance will be there. So this is about the manpower and the duties. So manpower and the duties, like for subcenter A, subcenter B. As we already know that in subcenter B, deliveries are conducted. So the manpower will be more in case of the subcenter. Okay, A&M 2 are required. Health worker, 1 male health worker will be required. May or may not be, the star mark indicates, asterisk indicate. Then Safai Karmachari, 1 full-time, and in case of subcenter, it will be part-time. Okay, outsourcing. So duties of this A&M, this will be taken in another class. So since we know the services provided in the subcenter, so those services which is provided, who are responsible for conducting those services will be taken in another class. So I'll skip this point. Okay, ASHA, very important, can be asked in short note also. There are points which are included. Who can be an ASHA? How many population to cover? And what are the roles? What are the functions? Okay, this one. Okay, let's come to the next one. IPHS PHC. In case of primary health care, so again in primary health care there are two categories, that is type A and type B. Am I audible, students?
Yes, ma'am.
Okay. So categorization, primary health care categorization, it can be again divided into type A and type B. Type A, again, here in primary health centers, what happens is that deliveries will be conducted, definitely, in both the types. But the thing is that the number of deliveries conducted in type A will be less than 20 per month, and if it is more than 20, then we call it type B. That is the basic difference. And we know that this is primary health center is the first health center where doctors will be available. Okay. So these are the services, or every services will be made available only. Whatever you write, it will be correct. Okay, like first is the maternal and child health, like the antenatal care, the basic antenatal checkup. What are the things to be done? Then intranatal checkup, postnatal, okay, because deliveries are also conducted. Newborn care, okay, essential newborn care corner. Then resuscitation, care of the child, okay. Then all the schemes, then MTP, all will be conducted. This is about the maternal and child health. Next is nutrition and adolescent. Nutrition, school health, then adolescent health, adolescent friendly health clinic. Okay, so I think we visited the PHC. Which PHC we visited? So we might have seen this adolescent friendly health clinic also. We have seen it, right? Which PHC you have visited? This can be asked in the exam also, so you need to know which PHC you have visited. Okay, then safe drinking water, like disinfection, promotion of sanitation, and all the health programs will be included under the IDSP. Under the PHC, like RNTCP, now name has been changed, NLP, IDSP, all will be included, and VBDCP and the other programs all will be included under the PHC. Okay, and referral services from if a particular case from the subcenter, they can also refer to the PHC, or otherwise if it is not able to treat in the PHC, they will refer it to the higher center. Okay, and monitoring and supervision also, like whether the ANM, whether the health workers in the subcenter, in the particular subcenter which is covered by that particular PHC, whether they are doing it or not, that is being monitored, and supervision, what are the changes to be done, how they have to conduct it, those services, this will be done by the PHC at the PHC level. Okay, and there will be laboratory, basic laboratory services will be also available. I am sure you all must have visited the laboratory services, like when you visit Maulai Mauro, and then Dingpaso PHC also was, we visited there also. So those basic laboratory services which are available on in those PHC, okay, we need to know. The next is regarding the manpower. Manpower is, one thing we have to know is type B more than 20, type A less than 20 deliveries are conducted per month. So definitely the number of the manpower in the type B will be more. Medical officer, essential and desirable too. Okay, Ayush, medical officer will be there, data entry operator will be there, then pharmacist will be there, then healthcare worker, female health assistant, okay, then this health educator will be there, lab technician will be there, since there is basic laboratory, lab technician, sanitary worker. So these are the things, basic things which we can write by our own if we understand it. Okay, so but and another thing, you have to add this medical officer and medical officer of Ayush, and the work of the medical officer and will be everything that we have to know it, which will be taken in the next class, like everything, the curative, preventive, promotive, and as well as monitoring, supervision, and all those programs, health programs will be looked after by the medical officer, health educator work, then health assistant, this will be taken later. Now coming to the IPHS of the CHC, Community Health Center. So this Community Health Center is the secondary level out of the 3 tier. Okay, so here in the Community Health Center, we call it first referral unit also. And when we say first referral unit, these 3 major points should be made available. Then only we will say that this particular center is a first referral unit. Availability of the surgical intervention, newborn care, blood storage facilities, very important. This is meant for conducting CS, okay, cesarean section. So if the delivery which is, so the cesarean section, in order to conduct a cesarean section, delivery by cesarean section, what happens is that we need a gynecologist, right? We need anesthesiologist, and then we need pediatrician. These are the manpower which are required, and among the materials what we require, blood storage facilities is also required. Please do not get confused with blood storage and blood bank, okay? It may not be blood bank, but if we have the storage facility, blood storage facility, then we can call it first referral unit. So these are the things which should be made available, then only we will call it first referral unit. So there are many community health centers in the real scenario, like gynecologist is available, but there is no anesthesiologist posted out there. So gynecologist himself or herself cannot conduct the CS, so it cannot function as a first referral unit. Or all the manpowers are available, but no blood storage facility is available, like that. Or gynecologist and anesthesiologist available, pediatrician not available, like that. This happens. So those kind of health facilities cannot be called as first referral unit, but according to the IPHS standard, what we want is all these three should be made available. Then only we will call it a first referral unit. So this means that in sub-center we do not have doctor, in PHC we have doctor, and in CHC we have specialist, right? So these are the manpower, okay? Okay, so block medical officer, public health specialist, public health nurse, general surgeon, physician, okay? Then gynecologist, pediatrician, anesthetist, dental surgeon, okay? GDMO, okay? MO Ayush, staff nurse, pharmacist of Ayush, lab technician should be there, ophthalmic assistant, radiographer, all these things will be there, okay? So these are the manpower. Okay, next is we have completed up to CHC. Next is district hospital or sub-district hospital. So sub-district or subdivisional hospital, then the district hospital, then these are also functioning as first referral unit. If at times, if the CHC is not functioning as the first referral unit. So the population covered, as we already know, that we learn about how much population is covered by the sub-center. We have specific number, right? So sub-center we have 5,000 or 3,000, then 30,000 or 20,000 in case of PHC, then 80 to 1.2. So when we talk about district, when we say about population, then it will vary, okay? So what we have to know is, in India, district, for defining a district, it doesn't mean that this many number of population will define a district. In some state, the district may be very large also. So that is why we do not have a specific population written out here. So you have to know that when you are asked how much population is covered by a district hospital, then you have to know that that particular district is that particular population of that particular district is covered by that district hospital. Okay. Like, for example, in case of Meghalaya, in case of northeastern states, one district is very small, okay? But if we talk about the central India, like in UP, Bihar, Madhya Pradesh, one district is very big, right? So that is what I mean to say. So that one district hospital will be there, and for that particular district, the population covered by that particular district will be the population, okay? This is about the three-tier system, okay? PH sub-center, PHC, CHC, district or sub-district, and district hospital. These are available in the rural setting. So when we talk about the urban settings, urban healthcare delivery system, we always tend to forget this. So please do not forget this. Under the public health system, under the government of India, we have health facilities, healthcare facilities, which is available in the urban also. Okay, so based upon the population, we have this one, healthcare facilities. Like urban community health centers, it will cover how many population? For every 2.5 to 5 lakh in case of metropolitan city, okay? And in case of urban PHC, 50,000 population. Every 50,000 population, one urban PHC should be there. PHCs are also available in the urban areas, that we call it urban PHC, urban CHC, okay? And case of ASHA, we should know that one ASHA covers 1,000 population in the rural, but in the urban we have 1,000 to 25,000 population covered by one ASHA, one ANM, 10,000 population. Okay, 20 to 50 population by Mahila Arogya Samiti. So this is about the urban healthcare. And the services which will be provided in the PHC, CHC will remain the same like that of the rural. Okay, like in the PHC, MO will be there. Okay, medical officer, general medical officer will be there. CHC specialist will be available. Okay, and regarding above CHC, too, we have the either the medical colleges or the tertiary sectors will be available. That is why we have not included it. Okay, in case of urban healthcare facilities. Okay. This is about the private sector. This is just the data about the private sector. Those are the public health sectors. Okay. Now coming to the private health sectors. Private health sectors. These are just the data. So we have one thing called PPP. Okay, PPP, public-private partnership. What happens here is that in public-private partnership, public will be the government organizations, okay? Private will be, mainly they will be focusing upon the profit or non-profit or voluntary sectors will also be available. And when this public and the private, they work together collaboratively, then we call it public-private partnership, okay? So the main objective of why we are having this public-private partnership is regarding the coverage, improvement in the particular areas like in the surgical field or in the facilities which should be made available, then to the community like the specialist kind of facilities, exchange of skills also, resource mobilization, strengthening of the health system, then range of services will be expanded, then risk sharing, community ownership will be there. Okay, so sometimes it is not possible for the community to that they will be able to afford the private sector all the time. But and again, if they go to so since they are not able to afford, what happens? They go to the public sector. So at times, what happens is that in the public sector, the facility which is provided may not be up to the mark. But if we have this PPP system, what happens is that at a lower cost, the community will be made available these services, the specialist kind of services will be made available to them. Okay, so these are the objectives under the PPP. So if you are asked about the example of PPP model in the health sector, these are some of the examples of the model, okay, PPP model. Like in Raichur, we have Rajiv Gandhi Super Specialty Hospital, which is functioning as a PPP. So, and it is a tertiary care. So, being a tertiary care, they will have all the facilities what a tertiary care should be made available. And this will be at the cost the community can afford. Okay. So government Apollo Hospital will be in a joint venture partnership. So if we go alone to the Apollo Hospital, it will be too costly. But if we go to this particular tertiary care, okay, then it will be at the cost the community can afford. Okay, Government of Arunachal and Karuna Trust also. Together, we have this rural healthcare delivery and management of the PHC. These are some of the examples, okay? And in the lab drugs supply and diagnostic services also, this is HIN Labs is one of the example. Okay, Ministry of Health and Family Welfare and HLL Care Limited. This is one of the example in case of lab drug supply. About the PPP. Next is indigenous system of medicine that we know already, Ayush. You have to know the full form of Ayush. Okay, so then there are voluntary agencies which we already knew from before. Okay, so what happens? We have to know about some of the names of the voluntary agencies which are available in India, like Indian Red Cross Society, very famous, right? So relief work, armed forces, family planning will be some of the services which is provided under this. Okay, these are some of the name of the voluntary services which are available in India. Okay, you have to name at least 2, 3, 4. You need to know, or you can be asked 2, 3, 4 for the Viva purpose, or you can be asked as a long question like regarding the IPHS standard. What are the services to be according to the IPHS center, IPHS standard, what are the services to be made available at the rural setting, okay, and at the voluntary services to be made available, like that you can the question can come, then this If you know 3-4 names, then you can write it up. Okay. So this is for today's class. I hope you understand. If you have any doubt, you can ask me. You have my mail address also. You can ask me later anytime. Okay, thank you.